How's it going, guys? Lecture number 9, the medical record. Man, I have lots of stories about medical records, especially coming from Alaska. There's a lot of crazy stuff that's happened over the past, 10 years, 15 years or so. Electronic health records are a new thing. Paper charts, man. You see in this picture how many paper charts are just sitting in, how many patients that is. It's just excessive. We had walls upon walls of paper charts. It's the most painful thing to deal with. People actually had jobs back 10, 15 years ago dealing with just paper charts. Ironic how things have changed. So this is what this chapter is about, the medical record. Written documentation about a patient depending on what's going on with the patient, their diagnosis, their treatment. There's a lot of stuff that's kind of ground into the medical record. It's very, very important that you have access to a medical record when receiving care, especially for the provider, because he wants to know what has happened in the past with the patient so he makes the right decision for the future. Really, really, really important. I'll tell you something really interesting, too, that I just thought about. You will be very surprised. Everyone's heard of like the black market or the dark web, I guess people call it. People sell things on the dark web they're not supposed to, like credit card numbers. What is the number one thing of highest cost on the dark web? So I'll give you a minute to think about it. Not really a minute, a couple seconds. You would be surprised if I told you it was medical records. People hold medical records hostage. And I'm not saying that to give you any ideas. I'm saying that because it's dangerous. So there's a lot of things that go into protecting electronic health records that we'll get into at the end. Medical records are really, really important. So what is the purpose? We really talked about that. The purpose of a medical record is to document what has happened in the past with the patient in regards to treatment from birth all the way until death. This can be very, very important for someone who's receiving cancer treatment. Maybe they're allergic to a drug. If it's not in their medical record, you wouldn't know, especially if the patient came in on an emergency basis and they're unconscious. So that's just one of the many examples. This JCAHO, remember JCAHO is not a funding requirement. Most hospitals do not have it, but JCAHO is a gold standard for hospitals. So if a hospital is JCAHO certified, that means they've gone above and beyond to practice at a high level. So this is some of the contents of a medical record. Evidence of an exam, documentations of the exam, and consultation reports, x-ray, lab notes, all that kind of good stuff. It's all in the electronic medical record or the medical record in general. So it usually happens chronologically. You track a patient's care from birth till death. And then you have a problem-oriented medical record as well, where someone comes in, there might be an issue. There's a lot of different things that come into it. You can make changes to a medical record. So we had this happen quite often when I helped oversee an HIM department. People would come in and say, hey, this is not right in my record, and I want to make sure that it's fixed. So they would document that and send it back to the provider, and the provider would kind of scratch it out with a line, document something different. You can't actually take it out of a medical record. You can't erase it. Falsifying medical records also is a criminal intention. Timeliness, we deal with this all the time with our providers. You have to have your documentation, you have to have your charts closed. It should be the same day, but it must be done within 30 days of discharge because how are you going to remember what happened 30 days ago, number one? And then based on billing purposes, there's also a lot of means that goes into getting reimbursed if you're not documented in a timely fashion. How can I submit a bill for a service if there's not even documentation on what happened? If it's not documented, it didn't happen. And on top of that, it's very, very important to document in a timely manner because it's safety. Malpractice lawsuits happen quite often because of lack of documentation from providers. I know providers gripe about this, especially in the new age, but it's important that it happens. Also, make sure you complete your entries all the way through. You don't stop in the middle. Make sure you finish everything the way it should be. Make sure you proofread. So make sure your documentation is complete the way it should be. I had some examples of some really interesting, funny documentation issues that happened, but I won't pull that up today because we don't have a lot of time, but there are funny things that people have put into medical records on accident. Make sure your documentation is complete. It's just the gist of it. Confidentiality is key. Don't talk about what's documented in a health record beyond who should know. It's really important to make sure things are kept private, especially in the healthcare setting, because this is important, and it's something that you're held liable for. Don't talk to your friends about it. Don't talk to your family about it. Things should be held in confidence, especially images. And, social media is a killer for people who make mistakes. Don't put anything on social media about your job, your role at your job, or especially anything about patients. Very dangerous. Not safe for patients. Not safe for patient care. It's a funny cartoon. Somehow your medical records got faxed to a complete stranger. He has no idea what's wrong with you either. How often does that happen? It has happened before, and it can be very dangerous. Medical records should be kept in the hands of people who are safe with them. A lot of hospitals have gotten into a lot of trouble for losing medical records or having privacy violations. Who owns a medical record? Really good question. Most people would say the patient. Thought process would tell you it would be the patient. It's not the patient. Courts has held that the originator of the record, so the provider or the hospital, is technically the owner of the record, but patients have the ability to access their record at any point in time. So just because a provider or a hospital owns a record doesn't mean the patient doesn't have access to that record. If the patient has a mental or emotional problem and looking at the record can make it worse, the doctrine of professional discretion can prevent the patient from looking at the record if the physician deems it necessary. So that's really interesting to know, especially with mental health. A lot of patients with schizophrenia shouldn't be able to look at their medical record because it can set off something that really can be dangerous for the patient. That's just an example. And I'm not a clinician, so don't quote me. It's really important that we take heed to this, especially if there's something in the record regarding mental health. And it's really great, I think, that we have the doctrine of professional discretion to protect from these issues. So the Privacy Act of 1974 gives citizens some privacy about their health care records and how to access them, but it goes into a lot more detail when we talk about HIPAA and the EHR statutes that came out recently. Electronic Health Record, for those of you who don't know what EHR is. And if I use an acronym that is confusing at times, I apologize. Feel free to reach out if you have questions. I know since it's on a recording basis, it can be challenging to stay up with the tasks, but I'll try not to use acronyms as much. Open record laws. Some states allow public access to records maintained by state agencies. It's really interesting. This is a little different with mental health, but keep that in mind. It's another thing with alcohol and drug abuse patient records. These have to be kept in kind of solitary hands. You don't leak this information out. It's private. There's criminal fines for violating this because it can ruin someone's life. So a lot of the information that's gathered from alcohol and drug abuse patients should be kept private. How to restore your medical records. You have to store them for at least 10 years from last date of entry. I remember thinking back at the last hospital I worked at. We had a basement full of medical records, and there was walls upon walls stacked with papers because we were still on paper charts at the time. You have to keep them for an extended period. But now with the EHR systems, you have the cloud, and it's secure, hopefully, if you're doing the right things, of course. So you're able to have access to records for an extended period of time. EMR, computerized medical records, electronic medical record. There's a lot more confidentiality here, but at times it can be a lot more dangerous, especially for hackers to get into your systems. You have to have a lot of technology-based privacy aspects. And you have to have experts in the field monitoring to make sure nothing happens with your firewall and things to protect electronic health records. Disclosing certain things, there has to be disclosure within a medical record without the patient's consent for AIDS, HIV, ARC. A lot of the things that can damage or hurt the provider in a certain scenario has to be documented in the medical record because we want to protect the provider as well. So that's in there, and I think it's very needed. You can be subpoenaed for a medical record in court. It happens quite often. You can face improper disclosure if you subpoena a medical record and it's really not needed. You don't want to use it upon the basis of just bashing someone. That's not the point. The point is to really dive into the case of the trial to make sure there's accuracies and the legitimacy of the plaintiff. But there's a lot of details that go into that, and the judge really has to make a decision on whether or not the medical record should be used in a court setting. We just talked about that. Subpoena. It's a Latin term. We had to do this quite often when a medical record was subpoenaed. Notify the physician, notify the patient, notify the physician's attorney. You go kind of down the line. You got to make sure you protect yourself, protect the physician, and protect the patient. Tells you a little bit about what to do with subpoenaed medical record. If you get a subpoena letter in the mail for a medical record at your employment office, hopefully you have an HIM department. Take it to them. Don't deal with it yourself, please. There's a lot of things that we don't know about. There's a lot of things that HIM specializes in that we should rely on them to make sure things are done in the right manner. So use your experts in the field. I say this about everything. You can't be an expert in everything. Use experts in the field to make decisions based on their career path. Compliance is one thing. If there's an attorney working for you in your office, go to him for that kind of question, or go to her. A lot of different information can be pulled if you access experts. So when dealing with medical records, talk to the HIM department. They're going to have more information on this. How do you respond to a patient when they ask, please give me my medical record since I own it? It's a good question. Really go back to your organization's policy. Don't try to debate the patient. And then send them to the HIM department. Send them to someone who can answer that in a way that is professional. Because it's going to be hard for people like us to say, no, you don't own it. You shouldn't say that. You should send them to the right people to answer that question. As a healthcare professional, are you able to read the medical record of a person you know? Why or why not? The answer is no. You should not get into a medical record unless you have a reason to do it. And the reason being you're involved in the patient's care. So stay out of medical records, especially if you're not involved in the patient's care. Don't go access your brother's record. Don't go access your mother's record. Stay away from that kind of stuff. Don't even access your own record. Can you be liable if you or your staff lose a patient's medical record? Of course you can be liable. Hopefully that doesn't happen, though. Overall, this is a really interesting slideshow. The medical record is really, really important. Everyone's doing well. Reach out if you have any questions. Thanks for all your help.